You are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views and opinions from across the world.
Hello listeners, I'm Urvashi. Today, we will discuss about the importance of CPR to save lives along with Dr. Tasneem Dhansura, who is a consultant, Department of Anaesthesiology, Saifee Hospital, Mumbai. Hello Dr. Tasneem. Welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, can you tell us what is the function of the heart and what will happen if it stops working?
When we start talking about sudden cardiac arrest and CPR, we need to understand what the heart is actually doing for us. So the heart basically pumps blood to various parts of the body. It takes oxygen-rich blood from the lungs. It takes oxygen-depleted blood to the lungs from various parts of the body. We all know that oxygen is essential for survival, and we need to understand that the brain is one of the most important organs which we need to preserve during this process, and the brain needs oxygen to function at all points of time. So basically, when the heart stops functioning, when the heart does not do what it's supposed to do, is when we call this a sudden cardiac arrest. There is a loss of the pumping action of the heart, and the heart ceases to beat, and this will eventually cause sudden death.
What is CPR and what does it stand for?
CPR stands for cardiopulmonary resuscitation. Resuscitation means bringing back to life.
Why should an individual learn CPR?
It's very essential that we understand that everyone should learn CPR. Cardiac arrest is basically a community issue, and it takes a society to save lives. 70% of the out-of-hospital cardiac arrests occur at home. 90% of people who suffer an out-of-hospital cardiac arrest die. To put it simply, if you save a life with CPR, it's most likely going to be someone that you love. It could be a child, a spouse, a parent, a grandparent, or a friend. What is also essential to understand is that every minute's delay in resuscitation of a cardiac arrest victim reduces the chance of survival of that victim by 7 to 10%. And if CPR is performed immediately by someone nearby, the chance of survival of the victims can double or triple. So basically, when we are giving CPR, the idea is to take over the pumping action of the heart which has stopped in a sudden cardiac arrest. The heart is inside our rib cage. It is placed very conveniently between the sternum or the breastbone in the front and the vertebral column or the spine that is at the back. Chest compressions take place when you're pumping the chest between these two rigid structures, that is the breastbone in the front and the spine behind.
When is the need to give CPR to someone?
We need to identify a sudden cardiac arrest. What a layperson who's outside the hospital, who's not a medico, only needs to recognize is a sudden cardiac arrest by understanding these small little things. You need to check for response. You need to tap loud on the shoulders of the victim and ask, "Are you okay?" If there is absolutely no response, identifying a cardiac arrest is very, very important. All that you need to understand is you need to check for response and look for breathing. If there is no response after you've tapped on the victim's shoulders and asked loudly, "Are you okay?" If there doesn't seem to be any response, if there is no breathing by looking at the victim's chest, we are to assume that this is a sudden cardiac arrest until and unless proved otherwise. So once you have identified a sudden cardiac arrest, once you've identified that there is no response from your victim, there is no verbal response, there is no breathing, there are no purposeful movements, you need to call for help. If you know where an AED is placed, you call for an AED as early as possible.
How to give CPR?
There are three main cord links that we would like everybody to know and understand. One is to ensure that the scene is safe before you start giving CPR. Identify that the victim is having a sudden cardiac arrest. call for help, and then start good quality chest compressions until medical help arrives. Good quality chest compressions consists of giving chest compressions in the correct spot. We need to give it at the center of the chest, on the breastbone, 2 fingers above the lowest end of the breastbone. We will interlock our fingers and use the heel of the hand to give chest compressions at a rate of 100 to 120 per minute. We will ensure that the depth is about 5 to 6 centimeters, not more, not less. And we will also ensure that there are no interruptions between chest compressions. Giving good quality chest compressions is very, very essential to continue circulation to all the vital organs, including the brain. Our main aim here is to take over the pumping action of the heart by giving these chest compressions externally between the breastbone and the spine.
What are the guidelines to give CPR?
There are multiple guidelines available from all over the world. Recently, the Indian Resuscitation Council has come with guidelines which are suitable for the Indian population. These guidelines encourage all laypersons to learn a compression-only life support CPR. That is, using your hands to give compressions. It is our endeavor to ensure that every citizen becomes a lifesaver. We encourage everyone, all people, to learn compression-only life support from the Indian Resuscitation Guidelines to help more and more lives being saved in our community. Our endeavor is to ensure that every citizen becomes a lifesaver.
When is the need for an automated electrical defibrillator?
An automated electrical defibrillator, or in common language it is known as a shock box, is a very useful device in all CPRs. Unfortunately, in our country, it is not very easily available unless you're lucky to be at an airport or in certain malls, or if your society or your area has an AED where you know where it is. What we would encourage you to do is call for an AED as soon as you're calling for help. If you have dialed 108 or a cardiac ambulance, an AED is going to arrive with that cardiac ambulance or an AED usually arrives with the cardiac ambulance or the ambulance that you call when you dial 108. An AED is a shock box and is very essential to be used as soon as it is available. We encourage everyone to use an AED as soon as it is available in case of a sudden cardiac arrest when you're resuscitating the victim. 90% of the times or 95% of the times, most of the cardiac arrests are due to an electrical disturbance. Using a shock box, which has been designed very comfortably for even use by an 8-year-old, there are many studies that say these shock box can even be used by an 8-year-old. All you need to do is follow the prompts of the automated electrical defibrillator, that is the shock box, and continue and use it as recommended. We encourage citizens to come forward and install AEDs in all different areas near their societies, in their complexes, at their workplaces, so that more and more lives can be saved.
What is the difference between heart attack and sudden cardiac arrest?
There is always a confusion about a heart attack. There's a lot of misconception about a heart attack and a sudden cardiac arrest. A heart attack occurs when the blood supply to a part of the heart through the coronary artery, which supplies blood to the heart, is blocked. There are signs and symptoms for a heart attack like chest pain, sweating, pain in the arm, pain in the jaw. So the victim can actually tell you that he's having a heart attack, and someone needs to recognize those, and this patient needs to be taken as early as possible to the hospital. With a sudden cardiac arrest, the victim does not have any symptoms. During a sudden cardiac arrest, There may or may not be any symptoms before the sudden cardiac arrest occurs. The heart suddenly stops functioning because of multiple reasons. A heart attack or a myocardial infarct may be a cause of a sudden cardiac arrest, but all heart attacks or all myocardial infarcts may not cause a sudden cardiac arrest, and all sudden cardiac arrests may not be because of a myocardial infarct. The difference is very simply described as a sudden cardiac arrest where CPR is required is when the heart stops pumping blood to the rest of the body. In a heart attack, the blood supply to the heart is stopped by a certain vessel which is supplying blood to the heart, where a part of the muscle of the heart is going to deaden over a period of time.
What message would you like to give to the society?
We encourage every citizen to become a lifesaver. We encourage every citizen to train their hands to save more and more lives. We encourage more and more AEDs to be put over all around the city, in schools, in colleges, in theaters, in malls, and in lots of other public places. Currently, AEDs or shock boxes are available only in certain areas, and they're not available everywhere. We encourage everyone to reach out in the city or in the town they are to learn the Indian resuscitation guidelines and learn compression-only life support. Once you have learnt that, you can go ahead and learn the further courses to empower yourself with the knowledge and try to save as many lives as possible. Because everyone needs to understand that giving CPR for a victim of sudden cardiac arrest is a community issue. Most of the cardiac arrests are happening outside the hospitals. 95% of the cardiac arrests are happening outside the hospital, and it eventually will take the entire community to save more lives.
Thank you, Doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that in times of emergencies and cardiac arrest, the importance of CPR mentioned by you will help in saving lives.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.